interesting. I'm wondering if there are any recent or maybe even not so recent research studies that have been exciting to you, any emerging insights that you're excited about.
So there's so much research that excites me. You can take it back to when we first did the studies with etanercept, the first biologic. That was a long time ago, and we were excited that 57% of the children were able to achieve a PASI 75. Now, that would not be considered a great response right now when we look at the increasing ability of biologics to get you to PASI 90 and PASI 100. So it's been a whole series of excitements since that time to now where we can virtually assure families that their children are going to be almost clear on these medications, which is great. Um, and more to come because everything that's now available in adults is in pediatric trials right now and hopefully will come to market because we're missing about half of them in the pediatric population right now, despite their shown safety in adults. I'm very excited about oral agents because the big problem in children, the only problem in children, because these are very safe in terms of the biologics, is the shot and the pain that's associated with the shot and the fear and the altered family dynamics that can happen as a result of children and even adolescents being fearful about getting these injections. This is the reason why ustekinumab, which is given every 3 months, is so popular now as the biologic. It's not that it's more effective than, for example, the IL-17 inhibitors. Um, and certainly TNF inhibitors, right? They're every 2 weeks. So it's this ability to space out the shots. So I'm very excited about something that takes that targeting of the very best, the IL-23, and moves it into an oral medication. I can't wait to see where that goes.
So there's a whole lot of knowledge about adults and psoriasis compared to kids. And I'm wondering how psoriasis changes in presentation as kids age. You're often dealing with prepubescent patients. And then when you hit puberty, do hormones impact what happens with their psoriasis presentation or even the severity? Does anything change with adulthood or even maybe going into the teens?
Well, it's a good question, and I don't think we know the answer because we've never done these longitudinal studies. I can't even really tell you the answer about hormonal effects other than the fact that we see the onset so often during adolescence. And is there a role of those changes that occur with the hormone alterations during that age that increases the chance that that's going to occur? And I really don't know the answer to that. Um, why we see more scalp involvement with children? Um, may- Maybe it's because there's more trauma. We certainly see more scalp involvement in females than we do in males. I happen to have 3 male children, and so I've always joked that they didn't spend very much time combing their hair, let alone what we often see in our, uh, female patients. So, I think that there are factors we just don't understand in terms of the difference that occur, but why we see much more in the way of typical psoriasis as we get older, or certainly during adolescence, and then very much so in adults, versus what we tend to see in especially some of the younger children, I think is an excellent question and something that we can only really better understand through doing some of the multi-omic studies, for example. Are we seeing more of some increases in some of the type 2 immune cytokines that occur in atopic dermatitis and dermatitis, for example, in younger children than what we're seeing in adults? We don't have any of that data.